And now we're ready to begin preparation. 2 vials of Cinryze are required for each 1,000 unit dose. Both vials of Cinryze should be prepared using the following steps. Step 1. Let the vial of Cinryze and the vial of sterile water for injection USP reach room temperature. Step 2. Remove the cap from the vial of Cinryze to show the center part of the rubber stopper. Place the vial of Cinryze on a flat surface. Step 3. Remove the cap from the vial of sterile water to show the center part of the rubber stopper. Place the vial of sterile water on a flat surface. Step 4. Wipe the top of the vial of Cinryze with an alcohol swab and allow it to dry. Do not blow on the stopper to dry it faster. After cleaning, do not touch the rubber stopper with your hands or allow it to touch any surface. Step 5. Wipe the top of the vial of sterile water with an alcohol swab and allow it to dry. Do not blow on the stopper to dry it faster. After cleaning, do not touch the rubber stopper with your hands or allow it to touch any surface. Step 6. Note: the vial of sterile water must be penetrated before the vial of Cinryze to prevent loss of vacuum. Remove the protective covering from the top of the Mix 2 vial transfer device package. Do not remove the device from the package. Step 7. With the vial of sterile water on a flat surface, place the blue end of the Mix 2 vial transfer device over it, pushing down until the spike penetrates the rubber stopper and the device snaps in place. The Mix 2 vial transfer device must be positioned completely upright before penetrating the rubber stopper. Step 8. Remove the plastic package and discard it. Be careful not to touch the exposed end of the Mix 2 vial transfer device. Step 9. Place the vial of Cinryze on a flat surface. Turn the vial of sterile water upside down and insert the clear end of the Mix 2 vial transfer device into the vial of Cinryze, pushing down until the spike penetrates the rubber stopper and the device snaps in place. The Mix 2 vial transfer device must be positioned completely upright before penetrating the rubber stopper. The sterile water will automatically flow into the vial of Cinryze because of the vacuum in the vial. If this does not happen, do not use the product. Step 10. Once all the sterile water is in the vial of Cinryze, gently swirl. Do not shake the vial of Cinryze until all the powder is dissolved. Step 11. Disconnect the vial of sterile water by turning it counterclockwise. Do not remove the clear end of the Mix 2 vial transfer device from the vial of Cinryze. Look at the final solution before using it to make sure that Cinryze is completely dissolved. Once dissolved, the solution in the vial of Cinryze should be colorless to slightly blue and clear. Do not use the product if the solution is cloudy or discolored or contains any particles. Note: 1 vial of dissolved Cinryze contains 5 milliliters of C1 esterase inhibitor at a concentration of 100 units per milliliter. Prepare the second vial of Cinryze by repeating steps 1 through 11 using a new Mix 2 vial transfer device. Do not reuse the Mix 2 vial transfer device. Step 12. Utilizing a sterile, disposable 10 milliliter syringe, draw back the plunger to allow approximately 5 milliliters of air into the syringe. Step 13. Attach the syringe onto the clear end of the Mix 2 vial transfer device by turning it clockwise. Step 14. Turn the vial of Cinryze upside down and inject the air into the vial. Step 15. Slowly pull as much dissolved Cinryze as possible into the syringe. Step 16. While holding the vial upside down, detach the syringe from the vial by turning it counterclockwise and releasing it from the Mix 2 vial transfer device. Step 17. Remove any air bubbles by gently tapping the syringe with your finger and slowly pushing the air out of the syringe. Note: repeat steps 12 through 17 with a second vial of Cinryze to make 1 complete dose of 10 milliliters. Step 18. Dispose of the vials with the Mix 2 vial transfer device attached to them. Note: Cinryze should be administered within 3 hours after preparation. The dissolved solution of Cinryze may be stored at room temperature prior to administration. If not used within 3 hours after preparation, throw away the solution of Cinryze.